Welcome to the Love Your Life and Yourself podcast, the weekly show where science meets soul and mom chaos meets mind mastery. You're not just a mom. You're a woman with dreams, a career, a body that needs care, and a soul that craves more. This podcast is your permission slip to stop surviving and start thriving in motherhood, health, career, and stress resilience. I'm your host, Dr. Ashley Rath, and every week we bring you actionable insights and transformative conversations to help you create a life you truly love. From evidence-based wellness strategies to authentic self-discovery, we'll explore what it takes to thrive through expert interviews and real unfiltered stories. Let's dive into today's episode. Today's guest is Dr. Luana Colloca, one of the world's leading scientists in placebo research and in neurobiology of belief. Dr. Luana is a physician, neuroscientist, and bioethics whose groundbreaking work reveals how brains filter reality and how our expectations, trust, and hope can literally change our biology. So her research has profound implications for pain management, clinical care, and the science of healing. Dr. Luana's insights challenge us to rethink what's possible when it comes to the mind, body connection, and how we can harness the power of belief to love our lives and ourselves more fully. Welcome, Dr. Luana.
Much, Dr. Rath, for having this call together.
I love it. So your career spans from medicine to neuroscience to psychology, bioethics. How did you get where you are? Give us a little story of your background and how you got to where you are right now.
Well, actually, I started when I was a teenager to plan to be a physician. So the goal was to help people. And after I finished my training in medicine, I practiced for a short time. I realized that there is much more to learn about our brain. I was particularly inspired by this charisma. I felt like patients were coming to see me and they were getting better independently of what I was prescribing. So somehow I wished to understand more about the brain functions, and in particular, how this connection, these therapeutic alliance, can be modulated and why eventually outcomes may change. And I love that you mentioned biology instead of health outcomes, because the idea was maybe this is a psychological mechanism not ground on brain changes. And I told my former mentor, after I finished medicine, I embarked in a program like neuroscience, PhD in neuroscience, to understand more how the brain works. And I mentioned to him, I don't want to do psychology. I don't like psychological approach. I needed to see fact. I needed to see change in the brain. So I started working with patients affected by Parkinson's disease, and we were implanting deep brain stimulation in those patients who don't respond to any pharmacological treatment. And in that context, intraoperative room, we conduct one of the first studies of placebo effects at the neuronal levels. Can the discharge of neurons change as results of administering a placebo effects, expecting to feel less rigidity, tremor, bradykinesia? And I was recording the neuronal activities, and you can hear the spike of the neurons in the brain. So after we inject subcutaneously sham apomorphine, so saline solution,
Yeah,
the
sugar
spike,
water.
yes, the spike of neurons starts changing. And for me, it was my epiphany. I decided that I truly want to learn more about the placebo phenomenon, but not only with the lens of a neuroscientist, but rather to understand in a broader way why our mindset can change our lives, our biology, our brain functions. And from there, I start, to study a brain mechanism connected to placebo effects, to expand into medical applications, translational approach, ethics of placebo. And was somehow a continuum because once you started to study this phenomenon, there are so many open questions. that
Mhm.
require us to jump in and learn new skills from bioethics to neuroscience and back to medicine.
That is absolutely fascinating, and it intertwines what I do from my profession, and that's why I reached out because I think it's so powerful to show us how those essentially kind of our thoughts are creating our reality or can shape our reality. And actually, let me ask you that. Like, let's go down that rabbit hole of our thoughts and versus our reality. You know, I'm guessing you've seen maybe in a lab or clinic or classroom these results. Do you have any like really cool stories
Many,
about this topic?
many. In particular, in my lab, I have many students. It's a large lab with students from different disciplines: medicine, nursing, psychologists, engineers. And I can sense that they are skeptical when they arrive to the lab, and we train them equally on how to perform the experiment, so how to learn the protocol. And sometimes they come with, their face and Luana, the patient doesn't feel any pain. After the procedure, their pain disappeared. I can't believe. And then, they become sort of ambassador of this line of research. But once they experience firsthand, they see the patient improvement or the patient stand up with, I want to buy this device. We use TENS, that stand for trans-electrical nerve stimulation, that is not even connected to the plug because we use as the placebo treatment. And
Mm,
one of our patients came back and say, I truly want to buy this device. The pain in my body disappeared. I feel much better. And we have to tell them the device was off. You experience a placebo response. And we had not one patient complaining. They say, I wish I knew more about this. I have hope now that my brain has still resources helping me to cope with the pain I endure. So it is very inspiring to see the testimonials of our patients that experience a placebo response, experience a drop in their pain, and they want to come back and somehow contribute to the science, but also they feel empowered because this experience of pain reduction make them feel that there is a hope, that there is still something that is beyond taking the pills, the treatment that they have been prescribed.
so let's break this down. So how does a placebo actually change someone's, in my opinion, perception? But it's actually a physical change too. Like pain is a physical symptom that people are experiencing. But if it's truly placebo, it's in their thoughts or perception about this treatment or out medication or whatever that is. So, can you break that down from like a biological level for me?
Actually, when we started this line of research that started now several decades ago, we observed the pain disappearing. And
Is what?
the pain was disappearing, and we were wondering what is that? Which
Yep.
component of pain disappeared? We know that pain has different components. We experience the intensity of pain that we can rate. My pain is 10 out of 10. We
Mhm.
can express the affective component. This pain interfere with my mood. This pain interfere with my ability to work. This pain interfere with the sleep. And the goal was to move from, okay, placebo affect pain in a way that those who respond experience analgesia, reduction of the pain. But what is happening from a neurobiological point of view? The very first studies that we conduct were pharmacological studies. So we use naloxone at a very high dosage. And the goal was to block placebo analgesia because if naloxone block the endogenous opioids, then by binding the receptor for endogenous opioids, then that means there is a release of endogenous opioids when we experience analgesia after a placebo. This was in the 1970s, and more studies show that we can block placebo analgesia with an antagonist of the new opioids receptors and other, not just the new, the delta and so on, or several opioids receptors. From this evidence that the endogenous opioid systems, so the endorphin that we naturally produce, can be blocked to reverse the placebo analgesic effects, prone us to study the brain mechanism. Why is this happening? Okay, we learn from a molecular point of view, there is a release of endorphin. We can even block with an antagonist, that is a drug that blocks the receptors to experience analgesia. Then the next step was, let's scan the brain. Let's see in the brain what is happening. And now there are several studies that have been conducted across labs. The very first one were in 2004, so almost 2 decades ago, show that different parts of the brain are involved when we experience placebo analgesia. This part of the brain include area that are relevant to quantify pain on a numerical scale, but also the affective component seems the most relevant, the way we cope with pain, the way pain interfere with our life. So the placebo component seems to be very strong on the affective aspects of pain. And that is something that we develop with several consortia, putting together the data from different labs to truly understand how placebo analgesia can make people feel no pain and why this is a neurobiological phenomenon. I think that was truly the revolution in this field, move from
Hmm.
psychology to neurobiology. That is why I love that you mentioned the biology. So we are not talking about a phenomenon that is merely, you know, therapeutic alliance or, optimal interaction with the patient or good practice. No, we are changing the brain and how the brain process symptoms, not just pain, fatigue, anxiety, depression, and so on.
That's incredible work. Like, that's so powerful. And then my logical brain is like, "Pff, I would never do that. Like, I can't, like, I'm not going to succumb to a placebo effect. Like, give me the real deal." Even though I am more, I would say, in a thought like leadership or thought like world where I do believe that thoughts do create our reality. But for someone who's never heard this before, they're probably thinking like this is crazy. Like this is absolutely insane. There's no way. So are there people who are more receptible to a placebo effect versus others?
Absolutely. In
Yeah.
fact, we tend to call participants placebo responders, placebo non responders. The definition per se may not be accurate because someone can respond today to a placebo and the next day do not respond. So the reproducibility of a placebo is very weak. But people may respond one day, may not respond the next day. And based on that, we classify participants into responders and non-responders. And this is classical in medicine. For any treatment we use, we have a patient who respond well, very well, and patient who respond so, or patient who don't respond at all. So the placebo is very much like any other treatment. Some people respond, and some people respond in a way that seems magical. The disease disappear and some other people do not respond at all. That has been one of our, line of research to discover more and more what characterize those people who respond to placebo and those people who don't respond. So we have been approaching that with socio-demographic factors, psychological factors, and omic and genetic factors. So there is to
Mm.
some extent a genetic predisposition, but the contest is overwhelming to the point that minimize the, you know, nature versus nurture. So Yes.
Do you see a lot of these programs or because when you're giving a placebo in the lab or in your clinic and you have these patients, their their perception is this outside thing is healing me, right? It's helping me, it's ridding the pain, etc. How do we take that concept and not need something external to still experience that healing? Like, do you have an example or a story of or a tip that we could do to achieve this? Because really that would be ideal to not have to have something external and like truly believe that we can heal ourselves and our body and like create new brain snaps.
The research we do now is not merely related to taking a placebo pill, but rather to understand how mindset and expectation can change the
Mm,
healing process. And for some patients, it's important to take a pill. For some other people, that is not so relevant. So
gotcha.
the mindset and how we shape expectations is super important. And that goes beyond the act of taking a medication. So that is why our research is focused more and more on understanding how expectation of an outcome of the healing process affect the healing process per se. There
Mm,
are examples like talking about a surgery for heart rate, open heart. So people were randomized to 20 minutes of conversation about what to expect from the surgery, what is the recovery time, and how you can change your fear, your appraisal into something positive towards the surgical procedure and the recovery. So patients undergoing surgery were randomized to two arms. One inform about, their expectation and the surgical procedure, and the other group standard, whatever we tell patient before undergoing heart surgery. Well, only 20 minutes of conversation about mindset, expectation, how the way we feel and perceive things it can affect the recovery, actually become a sort of self-prophecy. Those people who were trained about their expectation improve much faster after the surgery and kept the improvement up to 6 months after the heart surgery. So the mindset,
mm.
it's so relevant in shape outcomes. I mean, earlier, our colleague physician were aware of this sort of self-prophecy. They were even afraid to do surgical procedure in patients who were extremely negative or because they knew how the mindset and the brain can affect the outcome of a surgical procedure and the recovery. So the idea is do not merely work around the placebo as a line of research linked to the act of taking a placebo, rather to understand how expectation, mindset affect healing processes.
That's fascinating. So like these doctors words, not just their tools like surgery and medications is really impacting patients' health and how the doctors speak to their patients is playing, I don't know the percentage, but it's playing a pretty big role in their overall recovery and health to surgeries, which is like that's wild to me. Like that's that's like earth-shattering. And then I go down to like, well, like let's talk about ethics. Like, can we just start giving patients placebos and see what happens? Like, and overall, they wouldn't have the negative side effects of a lot of the, pharmaceuticals that are prescribed.
There are ethical concerns about using a placebo. The very first and classical was the deception linked to giving placebo to patients. So, and that has been somehow a concept that has been overcome because now we have been using open label placebo. So that means patient received placebo and they were told that you received a placebo. So even open label, non-deceptive placebo show results for chronic low back pain, for dysmenorrhea in younger women, and so on. So the question is then why do we need, in younger women, teenagers, to have so many, you know, pain medications when you can get
Hmm.
same results with a placebo, for example. So I feel like the balance between experiencing side effects from medications and being able to have the same outcome with a placebo treatment require an ethical analysis, when and why we could use open label placebo, non-deceptive placebo.
Right. Yeah, I'm all about informed consent. Not that we're tricking our patient unless they sign up to be in a clinical study, right? But it's it would be fascinating to me if that were the medical community is essentially like conservative, let's try this first, see if it works, and then after that, if it doesn't, like, then let's look. And you talked about pain a lot. Have you noticed have you noticed this same response in, I would say, like, more of the psychological anxiety, depression, like mentally emotional challenges that people experience?
It is unfortunate that we have been focused so much on pain. And
Okay.
the reason is because in pain-free participant health controls, we can give painful stimulation and study the effects in a lab. It is more
Mm,
difficult to create anxiety, depression, bipolar, schizophrenia in a lab. But I feel like that should be the next priority. We know a lot about pain, and we do need to move, for example, to mental conditions when the brain works and see the world around us in another way due to psychosis, schizophrenia, bipolar. Do we see the same placebo effects like for pain or for people with depression and anxiety? In depression and anxiety, there are studies show that placebo effects can be strong, and there is little evidence yet about open label placebo. Only one study was conducted with depressed patients with negative results. So the line of research has been primarily mm, focused to chronic pain, acute pain, tapering opioids with placebo. And yet, I think there is a huge potential to expand into other area of medicine.
mm, yeah, I can see that. There's just so many more layers. Going back to pain, so in this world full of opioids and medication, do you think we're anywhere close to seeing how these tools are essentially widely adopted?
I think it will be great to find protocols that allow physicians to adapt open label placebo without any deception into the protocols. An example can be dose extending placebo. Human respond very well to conditioning, to learning. So the idea is instead of replacing active treatment with placebo, we could mix the two. And for example, provide active treatment for several time and then placebo or subtherapeutic dose of the active treatment to
Mm,
taper the total amount of corticosteroids, opioids, especially with medication with high profile of side effects, could be helpful to add to the therapeutic protocol
yeah,
active
it's
drug.
like a happy medium.
Yes, exactly. Actually, we
And then
published.
the pharmaceuticals won't be so pissy at us, right? Because they're still making some money.
Yes, yes, exactly.
Right? I mean, there's got to be some policy around that if we start doing
That is, so
placebos.
we don't
That's
have a policy yet. And
yeah,
we truly need to move into policy to be able to develop protocols where,
yeah.
we can mitigate the side effects, optimize the therapeutic plan with adding non-deceptive placebo to the plan.
Hmm. That's fascinating. So, in addition to that, your team is researching some non drug interventions like virtual reality. Tell us about that.
We started by serendipity. The lab does pain research, and at University of Maryland, we were approached by actually surgeons that were using virtual reality in the ER to reduce opioids intake.
Hmm.
So the goal was, okay, we use that. We have no clue why virtual reality works. Do you wish to work together? Can we leverage your strength, your love, your team, and see why VR works? So first, for those who are not familiar with virtual reality is a tool that brings a patient through headset goggles to be immersed in another reality. This reality is immersive in the sense that we have 3D sound, 3D visual representation of different content. Patients can immerse themselves into something that is new, and in terms of auditory, visual, and sometimes somatosensorial input can be very, unique. In fact, there is this wow effect, because it's different than see the world around us. You are immersed in something that isolates us from the world.
Is it more of a distraction? Kind of like, I'm just thinking of like a toddler and they like trip and hurt their knee. And then you're like, oh, look at that cool bird over there. Like, and then their knee doesn't hurt anymore. So
There is
is
a
it
distraction
just,
component. Yes,
yeah.
distraction is relevant. But what we discover is that it's not only about distraction. There is mood regulation, they improve their mood, but also a reduction of anxiety. And more importantly, there is an activation of the vagal stimulation. So
Mm,
this ability to relax, to detach,
yep.
and that is not only load of attention distraction, there is more regulation of autonomic response and mood regulation, anxiety reduction, together with the attention, of course. And begin in the goggles, limit our distraction from all we see around us. So from this anecdote that they were putting goggles in patients with trauma in the ER, being able to do a cleaning of a wound with no opioids or less opioids, it somehow stimulate us to look into the mechanism of virtual reality. We start using virtual reality with experimental pain in pain-free health controls. Then we move to chronic pain, then to trauma pain, and we have been seeing amazing results. First, patient love virtual reality, and there is this modulation of the sympathetic system, the mood improve, the ability to sleep improve. So in that sense, it was a very interesting process from study the mechanism to translate them into clinical trials. So the goal was and has been understanding the mechanism. It's only the distraction, there is something more, and then offer this to patients at the bedsides or at home to mitigate either acute trauma pain or chronic pain.
Oh, that is just insanely fascinating to me because really what it comes down to is that neurological regulation, right? Like you are firing less in that sympathetic fight or flight mode and regulating the nervous system to be in more of a parasympathetic, where that is where true health occurs. Like, right? That's where healing occurs. That's where your immune system works better. That's where your digestion works better. That's where you can fire in your prefrontal cortex and start getting critical and logical and have empathy. And you get out of that survival mode. And so is this virtual reality almost like an easy, like the way I think about it is like it's almost like a meditative state where you get them out of that stress response and you're firing the vagal tone or nerve and kind of hijacking their nervous system, be like, hey, knock it off, like let's fire in the parasympathetic so we can actually heal and grow and restore like we're supposed to.
You use the right words, you beautifully framed that. And for us was a nice transition to again understand the biology of our brain, and now again we need something that can be an open label placebo or now a VR tool to hack the brain and somehow regulating mechanism that often we can't do with the classical pain therapeutics, that
Mm-hmm.
patient get as prescription. We have a beautiful testimonial. So the local TB in Baltimore contact us. Can we come to interview you? Do you have a patient who use virtual reality? I say, yes, we have several. So once the patient was talking to the reporter, he revealed much more that we knew. He said that when he started virtual reality with us, we offer virtual reality for 5 weeks at home. He had a restart using opioids, and he was severely affected by pain. And he told his family, I'm afraid that I'm becoming again dependent. He was, addicted to opioids when he was young. For 20 years, he was free. And then he went back to prescription of opioids to mitigate his chronic pain. And he realized, you know, I'm again there in a dangerous spot. So he told the reporter that begin enroll in this study using everyday virtual reality, allow him to stop completely the administration of oxycodone.
Hmm.
And he continued to work
Wow.
in our study to be an ambassador, to be what we call patient partner. And he shared this beautiful testimonial, the fact that something that you can't do by yourself, you can't even do with your doctor, that continue to prescribe opioids, and then 5 weeks of virtual reality help you to regain control of your life, control of your symptom, to the point to say, I don't need opioids for my pain.
Hmm. That is incredible. Like to think about how that could actually be a first line of pain control instead of the second line. And even the placebo, I mean, is it placebo or is it rewiring? Like, I just think about that, like virtual reality, like, and placebo, like, you're actually, I mean, placebo is actually rewiring. So, yes, it may not be like a chemical, but when you start rewiring your brain, it's not just not doing anything anymore.
Yeah.
It's a whole new nervous system firing, which is
And
it's that just is like, oh my gosh, that's so cool to me.
we try
But
to rewire the brain with cognitive behavioral therapy, with mindfulness, with meditation.
uh-huh.
The issue is that often to rewire the brain with these psychological approaches, we need 8 weeks treatment.
Mm,
With VR, we see tangible improvement after one session of VR. So
wow.
that is the point.
Wow.
Maybe our brain needed to be reconsidered and how the biology affect outcomes. There are probably tools that can be placebo effect, reshaping expectations, or even using a tool that immerse patient in a new world, eh, empowering patients to do things that by themselves they could not do.
Is there like, so what are you actually playing in their goggles or like VR? It's probably not like zombies and fighting.
So the choice of the content was direct by focus group. We realized that we don't want exactly things that make patient. So we create at the beginning a, our own content that was mostly music based. And also we use something that was available on the market, the blue that I immerse people in the ocean. But there is now a growing interest, and several companies have developed pain programs where
Mm.
actually they go through sessions that simulate the CBT, journey. Today we learn to accept pain, and there are voice describing psychologists and beautiful scenario. Or today we just relax and we go to Mallorca, and they bring the patient in a museum or in a new environment, and they are able to explore and so on. We have been focused on music a lot, different kind of music, from opera to nature-based music, to even pink noise. So music that somehow can affect the neuronal discharge. Other group
Mm.
been more focusing on having a conversation like we have now, but in the 3D environment in the goggles. There are no comparative studies to truly know, do we need a pain specific program or just immersion in a beautiful ocean that is graphically rewarding can do the same effects? This is an open question. We don't know yet.
Have you have you used this? Like, I'm just thinking personally, I'm like, oh, I could use this as like a biohacking tool to just get healthier. Like, I don't have any like big health concerns, knock on wood, right now, but I'm like, gosh, if I could, get into a parasympathetic state and get even healthier, like, isn't that truly what we want? Like, from a vitality standpoint, is to continue to essentially kind of biohack that aging process once you start aging to continue to be healthy. Is there anything on the market or anything like that that listeners can get to do this
There is
themselves?
growing interest. I mean, you can find now VR for so many different things, from for kids, for adults, and even for people who experience dementia. We published
Mm.
actually with some colleague of mine, and even people with dementia can reduce the intake of a medication or improve their physical activity because we can have avatars show the movement and to be able to use what we call embodiment to have avatar that train you to do rehab. And that is true for people who had like surgery for hip replacement or an old person with dementia who struggle to do exercise. So again, through the VR, we can do rehab and the process of see another avatar moving into the goggles become again a very strong tool to help mimic the same movement or have a control of movement. So there are several now options in terms of content for different problems, from anxiety to sleep regulation to pain to rehab to so
Mm. Where do you see this going? Like, where do you see in the future? Where's the next frontier?
it's expanding in a way that is so fast. And, there are many other lab coming up with new idea. I think there will be VR in rehab, in pain management, in education, in post-traumatic stress, in depression. So, and sometimes patients feel less stigma to, be in the VR with an avatar, with, telehealth approach that drive to the doctor and receive help in person.
Can I get one for my patients?
Sure,
You gonna send me one?
good.
I'm serious, Luana.
Sure, let's talk
Oh,
about
I love it.
we connect and you can
Yes. All right. We are coming up. I know you are insanely busy and do a ton of research. Where can people find your work? Where are you at?
I think that is the strength of this line of research, learning about how the brain can change the biology and the symptom of a patient can help us to optimize treatment. You mentioned something relevant, policies. We truly need to develop policies to be able to give access to this brain-based intervention where rewiring the brain is the goal. And to try to understand those patients that can be responsive to VR versus placebo versus, something else is very important because could help us to minimize overtreatment disease, especially chronic disease, and hopefully see some light, because often chronic disease tunnel for our patient and their families.
Hmm, I would agree. Thank you,
Thank you.
Dr. Luana. Like, this has been such a joy. And I like to leave of the question. So, what's one piece of advice What's one piece of advice you'd give to our listeners trying to love their lives and themselves more fully?
Absolutely. Love and self care is so relevant, not only for, well-being, ethical issue, but also to fully empower the brain functions. There are parts of the brain that can be still activated when everything seems, do not work. So don't give up and try to, instead of looking outside, look inside for resources that you may still have and you didn't experience yet just because you didn't look out.
Love it. Thank you so much
You are
for joining me
very much.
today. It's been such a pleasure.
Thanks.
Thanks for tuning in to Love Your Life and Yourself. I hope today's episode gave you one more tool or one more truth to help you thrive in your health, happiness, and resilience. Remember, loving yourself isn't selfish, it's leadership. And it's the foundation for building a life that actually feels like yours. If this spoke to you, hit that follow button, leave a review, and send it to a friend who needs to hear it. And if you want to dive even deeper, grab a copy of my #1 best-selling book, Love Your Life and Yourself. It's the heart behind this podcast, and it's helped thousands of women step into a life they actually love. You can find it at drashleyrath.com or through the link in the show notes. Until next time, take care of you and keep choosing to love your life and yourself.